It's very easy, of course, now that we're down to level 4, to compare the number of cases week on week. Is that an accurate way of trying to interpret the data?
No, Cathy, it's not, because we will get a very skewed picture if we just look at the cases from day to day. It was fine to have done that up until April 6, when the number of tests we did were more or less the same each day, and the sources of the samples that we tested were the same. So prior to April 7th, all the tests we did were coming from patients who were attending doctors' rooms or hospitals. But on April 7th, that changed because we started to send community health workers into the field to find people to test. So we're now testing 2 different kinds of populations. Sick people who go to the doctor and people we find by knocking on doors who are not necessarily sick. They may just have mild symptoms. So because of this community testing, we now have far more people testing positive than in March and in early April. And when the number of tests increased, which is what we have been doing, the number of positive cases will obviously increase as well. So to compensate for the fact that we tested only 1 type of population before April 7th and now we're testing 2, a better measure to look at is the percentage of tests that are positive. And if we look at that rate, which is round about 2.7% of tests, we have seen little difference in the proportion of positive tests over the last 5 weeks, but we'll obviously now start to see an increase because of more movement and the relaxing of lockdown regulations.
Mia, I wonder, because we've also heard reports of some provinces that are not being fully open in terms of the number of COVID cases that they are tasting. There doesn't seem to be full disclosure. What is the best way of aggregating all of this data?
Well, there are actually 2 sets of data going around, and as you've mentioned, it's not regularly released. So there's one set of data that the National Health Department has, and then each province has data, and it's often a little bit different from the national health departments because they use different date ranges, not always the same as the National Health Department. The problem is that only 2 provinces, the Western Cape and Gauteng, releases it publicly. So for us as journalists or the public to try and figure out to compare cases between provinces is very hard to do. We know the cases, but we don't necessarily know how many people they test. And as I've mentioned in the previous question, that the more people you test, the more positive cases you'll have. So you can't just look at the cases, you need to look at the percentage of positive tests. And that's very hard to determine if you don't have access to the data.
Well, it sounds like we certainly need more transparency coming through from the other 7 provinces in terms of releasing those figures and making them public. When we get to a point like we are now, where the Western Cape has the highest rate of infections, Gauteng also being having a high concentration of cases, are we likely to see different levels of lockdown in different provinces? Do you think that that's where we'll head to in the future?
Well, it's certainly possible because the government's strategy is all about risk adjustment alert levels. So there's really no reason why a district or ward that has very few cases needs to be at the same lockdown level as a district where there are lots of cases. And I think we're also likely to see a constant adjustment of lockdown levels across the country.
All right, Mia Malan, thank you so much for your insights. She, of course, is the editor at the Bhekisisa Centre for Health Journalism.